We have two lectures on cardiomyopathy. This first one is going to concentrate on dilated cardiomyopathy and arrhythmogenic right ventricular cardiomyopathy, and a subsequent presentation will concentrate on hypertrophic cardiomyopathy, especially in cats, as well as other forms of cardiomyopathy. Cardiomyopathy is a heterogeneous group of cardiac diseases that involve something wrong with the myocardium. This may result in mechanical dysfunction or electrical dysfunction, such as arrhythmias, and in most instances, these result in either ventricular hypertrophy or dilation. The causes are presumed to be genetic in many cases, and cardiomyopathies can be confined to the heart or part of a generalized systemic disorder. Cardiomyopathies often lead to weakness, exercise limitation, syncope, progressive heart failure, or cardiovascular death. Cardiomyopathy can be classified a variety of different ways depending on the anatomic structure or the hemodynamic changes that occur with cardiomyopathy. Here are four common forms of cardiomyopathy in veterinary medicine. The first is dilated cardiomyopathy, where there is chamber enlargement as well as thinned walls of the left ventricular myocardium, which can eventually affect all chambers of the heart. And classically with dilated cardiomyopathy, there is systolic dysfunction, although most animals that have congestive heart failure also have a component of diastolic dysfunction. Hypertrophic cardiomyopathy leads to concentric hypertrophy, sometimes with a small cavity, and in some cases there is a left ventricular outflow tract obstruction. Hypertrophic cardiomyopathy is often judged to be more predominantly a disease of diastolic dysfunction, although in the advanced stages of the disease, some cats will develop systolic dysfunction as well. Restrictive cardiomyopathy, again, is a form of diastolic dysfunction, most classically recognized by endocardial thickening or fibrosis, leading to inability to fill the left ventricle and progressive left atrial enlargement. And the final form we'll talk about is arrhythmogenic right ventricular cardiomyopathy, which is especially common in boxers, but also seen in English bulldogs and cats. Here are pictures of various forms of cardiomyopathy. This in the upper left corner is a cat with hypertrophic cardiomyopathy, and you'll note the thickened walls of the heart. On the lower left is dilated cardiomyopathy, where the left ventricular cavity is dilated and there's left atrial enlargement as well. In the lower right panel, there is restrictive cardiomyopathy with the endocardium having significant scar tissue or fibrous tissue formation. And in the upper corner, we have a version of arrhythmogenic right ventricular cardiomyopathy where there's loss of myocytes and replacement with fibrous and fatty tissue. Cardiomyopathy can be a result of intrinsic disease in the heart and thus might be referred to as primary cardiomyopathy. And again, many times this is a result of a genetic mutation, but it can develop from certain non-genetic or acquired forms. Cardiomyopathy could alternatively be described as being originating extrinsic to the heart or secondary cardiomyopathy. And these are myocardial diseases secondary to some other identifiable systemic or multi-organ dysfunction. And so doxorubicin administration has the potential to result in something that looks like cardiomyopathy. And some people prefer to refer to this as doxorubicin-induced cardiotoxicity as opposed to cardiomyopathy secondary to doxorubicin. Of the various cardiomyopathies that are known to occur in both people as well as veterinary medicine, we have a chart here listing them as being either genetic or a mixture of genetic and acquired causes or clearly acquired disease. And the green arrows are the ones that are probably the most common in veterinary species, with the yellow arrows being ones that have also been described in veterinary species. So common cardiomyopathies in veterinary medicine include hypertrophic cardiomyopathy, which is most common in cats, dilated cardiomyopathy, which occurs in many species, restrictive cardiomyopathy, arrhythmogenic right ventricular cardiomyopathy, also called ARVC. We do see animals that have myocarditis that leads to dilated cardiomyopathy type of phenotype for the heart. And then sustained tachycardia over a series of days or weeks will also lead to a cardiomyopathy. This is sometimes referred to as tachycardia-induced cardiomyopathy. Again, there's another way to think about the various things that can cause cardiomyopathy. This is useful because if you can identify an underlying cause, you may be able to reverse it. So this is a list from the human medical field, and the ones in green are ones that have clearly been identified and reported in veterinary medicine. So how important are cardiomyopathies? In cats, cardiomyopathies are clearly the most common cause of heart disease, and they likely account for 70 to 90% of all feline heart disease. In dogs, cardiomyopathies are the second most common form of heart disease after myxomatous mitral valve disease, and they likely account for 12 to 20% of canine heart disease in our clinic. Ferrets also get cardiomyopathies, and cardiomyopathies are known to occur in just about every other species: horses, primates, and a variety of zoo species, in addition to birds and other ruminants. The clinical manifestations of cardiomyopathy are often in one of three categories: either congestive heart failure, or cardiac arrhythmias, or thromboembolism. Congestive heart failure is usually going to result in dyspnea and or abdominal distension or peripheral edema. Cardiac arrhythmias can lead to syncope, episodic weakness, or sudden death. And thromboembolism can result in acute lameness or other signs such as acute central nervous system signs. Let's talk about dogs and dilated cardiomyopathy. The classic findings are dilation of all four cardiac chambers, although it's possible for the left heart changes to predominate, especially early in the disease. There may be thinning of the interventricular septum, left ventricular wall, and right ventricular wall. The papillary muscles may become atrophied. There may be enlargement of the AV ring as a result of this dilation of the heart, and that can lead to secondary mitral and tricuspid regurgitation. When congestive heart failure is present, we may see ascites, pleural effusion, pericardial effusion, pulmonary edema, or hepatomegaly. Pathologic changes are often not impressive when it comes to histopathology. You may see mild endocardial fibrosis or interstitial fibrosis and edema and evidence of myocytes dying. Certain forms of cardiomyopathy, especially perhaps boxers and Dobermans, may have a mononuclear cell infiltrate. And large breed dogs are described to have attenuated wavy fibers on histopathology. Here's a picture of a normal myocardium at the bottom and attenuated wavy fibers up at the top. Doberman pinschers can have changes, especially in the left ventricle and interventricular septum, that show a degree of inflammation in addition to fibrosis and some lipid replacement in the myocardium. On electron microscopy, this is electron microscopy of a normal dog for comparison. This is from a family of Portuguese water dogs that developed cardiomyopathy early in life. An affected dog here has myocytes that are having the sarcomeres degenerate and the myofibrils are falling away. And here's a dog with advanced changes on electron microscopy from cardiomyopathy. In dilated cardiomyopathy, the main pathophysiologic hallmark is systolic dysfunction, reduced contractile function, although when heart failure develops, diastolic dysfunction is also typically present. As a result of reduced cardiac output, the classic neuroendocrine compensatory responses are triggered. Dilation of the heart and the mitral or tricuspid valve annulus leads to secondary regurgitation at those valves. And congestive heart failure may be manifest as left-sided, right-sided, or biventricular heart failure. Cardiomyopathy in the dog is very likely a heterogeneous condition, that the appearance of dilated cardiomyopathy is sort of an end-stage phenotypic appearance from a variety of things that are not working. In people, there's a number of genetic mutations that have been recognized to cause cardiomyopathy. And in boxers, there's some work to suggest that striatin may be associated with dilated cardiomyopathy. And there are at least 2 genes in Doberman pinschers that can be associated with the development of dilated cardiomyopathy. The role for taurine deficiency has been documented in certain settings, and whether carnitine or other diets may play a role is a little unclear. Large breed dogs such as Irish Wolfhounds, Great Danes, Newfoundlands, German Shepherds, Labrador Retrievers, and Golden Retrievers may develop dilated cardiomyopathy. Doberman pinschers and boxers have their own form of cardiomyopathy that we'll talk about individually. Cocker Spaniels are one of the few small breed dogs that develop dilated cardiomyopathy, and a variety of other breeds have been described. In general, there seems to be a slight male predisposition for the development of overt signs of cardiomyopathy, although genetic mutations are not clearly showing a male predisposition. And in most dogs, cardiomyopathy develops in middle-aged or older dogs. The exception might be a juvenile form in Portuguese water dogs, and we see certain pit bulls that develop cardiomyopathy quite early in life. Historical findings are variable, and cough may be present if there's congestive heart failure, and dyspnea may also be seen, and it might be worse at night. Syncope can be a result of low cardiac output and/or cardiac arrhythmias. Animals, as they develop congestive heart failure, may have loss of appetite, or they may become picky with regard to what they want to eat. And weight loss, especially muscle loss over the back or the rear legs, may be seen. It's not unusual for a dog with dilated cardiomyopathy to be misdiagnosed with bronchitis, since these dogs might not have a significant murmur, and they might not have identifiable arrhythmia, and they might just cough, and the radiographs sometimes look a little bit like bronchitis before you get overt alveolar flooding. Cardiac murmurs can be heard in dogs with dilated cardiomyopathy. Often a soft 2 to 3 out of 6 systolic murmur can be noted over the mitral or tricuspid valve location as a result of mitral or tricuspid regurgitation. An S3 gallop may also be noted as a result of altered cardiac filling. A number of animals may also develop cardiac arrhythmia. Arrhythmias such as ventricular arrhythmias or atrial fibrillation may be noted. A variety of findings may be noted on physical exam, and these may be impacted on whether congestive heart failure is present or whether dogs are in an early phase of disease, which might be called the occult phase of cardiomyopathy. The heart rate is variable, but it's faster if there's either congestive heart failure or serious arrhythmia. In dogs with pulmonary edema, you may notice pulmonary crackles, and if there's pleural effusion, the lung sounds may be dull ventrally. If you squeeze on the trachea, you may be able to hear the cough, sometimes described as a brassy cough. Arterial pulses are classically weak due to a reduced stroke volume of the heart. The apex beat may be caudally displaced or slightly weaker than normal. And if there's ascites or pleural effusion, you may notice jugular vein distension, or there may be a positive hepatojugular reflux. Mucous membranes may be pale with delayed capillary refill time, especially if cardiogenic shock is developing. And in situations of cardiogenic shock, you may also see low body temperature, weakness, or cool limbs, especially peripherally. Thoracic radiographs often show generalized cardiac enlargement with tracheal elevation. Left atrial enlargement is commonly seen. And if there's congestive heart failure, it usually starts out as an interstitial pattern, progressing in large breed dogs to a bronchial pattern and eventually an alveolar pattern. Classically, pulmonary veins are bigger than pulmonary arteries. The caudal vena cava and liver may be enlarged if there's a component of right heart failure, and there may be pleural effusion. The vertebral heart size may be abnormal, especially in deep-chested dogs such as Doberman pinschers. The VHS may be helpful. Here's a normal dog for comparison to look at cardiac size as well as the pulmonary pattern. This is the dog with dilated cardiomyopathy and significant cardiomegaly with no congestive heart failure yet. The trachea is elevated, the left atrium is enlarged, and overall the cardiac size is significantly increased compared to normal. This is the dog who had osteosarcoma and also had, unknowing to us, dilated cardiomyopathy, an early phase, and the dog was receiving doxorubicin and serial radiography. So on each of these subsequent pictures, we're going to have the lateral view of the chest X-ray, which then in this square is going to be blown up to the right of it, where we will see the pulmonary veins coming back into the left atrium, and we'll be looking at the lung pattern and to see if there's any interstitial, bronchial, or alveolar changes. This is a later point in time. The heart is a little bit bigger. The left atrium has become enlarged, and the pulmonary vein is getting just a little bit big as well, where it plugs into the back of the heart. And there's a mild increase interstitial pattern on this picture compared to the prior radiograph. Some more time has passed, and the dog has developed cough, and radiographs are repeated. Again, there is progressive left atrial enlargement with pulmonary vein distension. And in addition, now you may be able to see little bronchial pattern here, little donuts. So there's interstitial pattern as well as a mild bronchial pattern with progressive left atrial enlargement. Over time, this progressed a little further, and now the dog has significant left atrial enlargement, a little bit of a pleural fissure line here, progressive vascular enlargement, and here you can see this sort of black line there. That's an alveolar pattern, indicating that there is some alveolar flooding in the lungs as well. Electrocardiographic findings are again variable. Some dogs have sinus rhythm, and if heart failure is present, you may see sinus tachycardia. Some dogs may have evidence of left atrial or left ventricular enlargement. Giant breed dogs often have atrial fibrillation, especially when they present with congestive heart failure. And ventricular arrhythmias may be seen in boxers and Doberman pinschers. Atrial arrhythmias are also seen in a variety of breeds of dogs that have dilated cardiomyopathy. Echocardiographic findings include dilation of all four cardiac chambers, but especially the left ventricle, with reduced fractional shortening and reduced ejection fraction. The LV walls may be thinned and the papillary muscles may be atrophied. Left atrial enlargement is usually present in dogs that have developed congestive heart failure, and we may see mitral and tricuspid regurgitation. So on the right-hand side, we have sort of the picture that we're going to look at here with the left atrium, mitral valve, and left ventricle. And here is the echocardiographic picture from a dog with cardiomyopathy on this long axis view, where we have left atrium, mitral valve, a dilated left ventricle with thinned left ventricular free wall and interventricular septum. This picture shows that same long axis view from a normal dog in the upper left corner. And on the right, we have a dog who has a dilated left ventricle with thinned walls. Papillary muscle is relatively small. and there's a secondary jet of mitral regurgitation as a result of dilation of the annulus. This picture again shows a normal dog in the upper left corner with a relatively normal contracting left ventricle. And for comparison, we'll see a dog with dilated cardiomyopathy on the right-hand side, where there's left ventricular dilation, thinning of the interventricular septum and left ventricular free wall, and atrophy of the papillary muscles compared to a normal dog. M-mode echocardiography shows a reduced contractile function, reduced excursion of the interventricular septum and left ventricular free wall compared to normal. And in the upper left-hand corner, we have a relatively normal relationship between aorta in the center and left atrium in the cartoon picture on the bottom, left atrium in red. And if we compare that to a dog with advanced dilated cardiomyopathy, again, the left atrium is markedly enlarged compared to the aorta, which often does not change much in size. The right heart of this dog is also enlarged. Certain laboratory testing may be helpful. The complete blood count may show a mild elevation of white blood cell count, but is usually not inflammatory. The chemistry profile may be perfectly normal, or if there's right-sided heart failure, modest elevation of AST or ALT may be seen. And in cases of cardiogenic shock, there may be prerenal azotemia. Azotemia is more common after the initiation of cardiac medications. Plasma and whole blood taurine concentrations may be indicated, especially in dogs that are eating an unusual diet or a high fiber diet, such as a lamb and rice diet. Blood pressure may be useful to know, since some of the medications we're going to start have a possibility to drop blood pressure. And NT-proBNP is typically elevated if there is heart failure, and BNP is often elevated in dogs with occult cardiomyopathy before the onset of heart failure as well. Classic management of dilated cardiomyopathy includes furosemide if there is evidence of congestive heart failure, an ACE inhibitor, pimobendan, perhaps spironolactone, and a variety of other medications. Dietary considerations might include reduction in sodium content, especially if the dog eats people food or other treats that are high in sodium. And if the dog is on a diet that's been associated with the development of cardiomyopathy, such as a high pea or lentil diet, the diet should be slowly changed. In most cases, it's appropriate to do some degree of exercise limitation to make sure that the dog doesn't overdo it and collapse during exercise. There's a variety of different syndromes that can be seen in dogs with dilated cardiomyopathy. We'll talk about a handful of those. So if we consider Great Danes and other large breed dogs, we may see left-sided heart failure or biventricular heart failure. Atrial fibrillation, as is seen in this ECG, is commonly found. Sudden death is possible in these dogs, and survival is often 6 months or less if they have congestive heart failure. However, some giant breed dogs will have atrial fibrillation without any overt changes on the echocardiogram. These dogs often have a prolonged survival, although some will progress on to congestive heart failure and clear-cut dilated cardiomyopathy later. In the dogs who have a normal echo, the term lone atrial fibrillation has been used to describe that clinical syndrome. Irish Wolfhounds commonly get cardiomyopathy. Their cardiomyopathy looks a little bit different than some other breeds. When congestive heart failure develops, they may be more likely to get pleural effusion, which is sometimes a chylous effusion. In one study, up to 50% of presumably normal Irish Wolfhounds have some sort of cardiac abnormality, either an abnormal finding on echo or evidence of cardiac arrhythmias. Atrial fibrillation is common when congestive heart failure develops in this breed, and the disease can be slowly progressive. Like the other giant breed dogs, there's controversy over the presence of lone atrial fibrillation versus whether these cases will sometimes progress to dilated cardiomyopathy. And a recent study identified that a proportion of these dogs will indeed progress to dilated cardiomyopathy. One study identified that pimobendan may slow the progression of disease and delay the onset of heart failure. Newfoundland dogs often also can get dilated cardiomyopathy, and atrial fibrillation is not unusual. They've been described to be predisposed to getting taurine deficiency if they're eating certain diets, again, diets that are probably high in fiber, lamb and rice type diets. Doberman pinschers commonly get cardiomyopathy, and in some studies, 40 to 60% of Dobermans eventually develop some change in their heart that could be consistent with cardiomyopathy. They often get ventricular arrhythmias, especially early in the disease, maybe even before the echo looks abnormal, and the asymptomatic dog is often described as having occult cardiomyopathy. There's a variety of ways on echo to try to discriminate dogs who have occult cardiomyopathy from normal dogs. Once clear-cut dilated cardiomyopathy is developed, it may be that approximately 40% of Doberman pinschers may die suddenly, often due to ventricular arrhythmias or ventricular fibrillation. And there are specific genetic tests which may identify dogs who are at greater risk for eventually developing cardiomyopathy. We haven't talked too much about the NT-proBNP test, but this gives an idea of what the normal ranges are, typically less than 900, with dogs who are at 3,000 or higher often having heart failure. And this 900 number might be the one to concentrate on here as we talk about Doberman pinschers. And there are one or two studies that suggest when the BNP in Dobermans is above 500 to 650 picogram per ml, that those dogs may be more likely to be in this red category here and either have or later develop dilated cardiomyopathy. Cocker Spaniels also get a form of cardiomyopathy. Perhaps one of the notable features that Cocker Spaniels are a little bit more likely to have low plasma or whole blood taurine concentrations. And if they are supplemented with taurine plus or minus carnitine, this can result in clinical and echo improvement in some dogs. And these dogs sometimes live longer than typical dogs with dilated cardiomyopathy. Portuguese water dogs can get a juvenile onset form of cardiomyopathy with sudden death or peracute heart failure. This often comes on somewhere between 5 weeks of age to 3 or 4 months of age. And there are some conflicting reports on the role of taurine. Some dogs who have a normal echo even at 6 weeks of age were noted to develop dilated cardiomyopathy by 6 months of age. So this clearly is something that develops as they are growing. Boxers are another breed of dog for cardiomyopathy, and their particular form of cardiomyopathy is often referred to as arrhythmogenic right ventricular cardiomyopathy, or ARVC for abbreviation. Typically, again, happens in middle-aged or older dogs, but it can happen very early in life. When they get clinical signs of relating to their arrhythmias, they often have a very rapid ventricular tachycardia, as is depicted here. The ventricular tachycardia is often 300 to 400 beats per minute. And the ventricular premature depolarization often have an upright appearance for the QRS in lead 2, sometimes said to have a left bundle branch block pattern. The ECG, other findings can include atrial fibrillation or changes in cardiac size. And a striatin mutation has been identified to happen in some boxers with cardiomyopathy, especially those that progress to dilated cardiomyopathy. In boxers with ARVC, Sudden death due to ventricular arrhythmias is quite possible, and sudden death may be more likely than the development of congestive heart failure. It might be that only 10 to 20% of boxers with ARVC progress to congestive heart failure. And in fact, early in the disease, when ventricular arrhythmias are first seen, the echocardiogram often looks normal. Sotalol can be effective in managing ventricular arrhythmias, and when that doesn't work, a combination of mexiletine plus sotalol or mexiletine plus atenolol can also be effective. In a handful of dogs, these don't work, and amiodarone or flecainide or other medications may be used. On histopath, these dogs often have replacement of myocytes, especially in the right ventricle, with adipose tissue and fibrous tissue. There may be a component of inflammatory change in the ventricle as well. And Holter monitor recordings are used to search for asymptomatic individuals. Some people have proposed a cutoff of greater than 100 ventricular premature depolarizations in 24 hours, and others have picked a number higher than that. Again, here's a boxer who had rapid ventricular tachycardia that was converted with lidocaine, and then the dog would have gone on to chronic oral antiarrhythmic medication. Dilated cardiomyopathy can be associated with taurine deficiency. This was from a dog who was on a vegetarian diet and developed severe taurine deficiency, 52, with a normal range for whole blood being 200 to 350. And in some dogs, if caught early, supplementation with taurine can help reverse their disease. Dilated cardiomyopathy has also been recently associated with certain diets. These diets tend to be having a high proportion of peas or lentils or other uncommon sources. Sometimes these have been advertised as grain-free diets, and some of them have exotic ingredients. This can be potentially partially or completely reversible if it's caught early. However, if the disease is caught after congestive heart failure is already present, it may be less likely to be reversed back towards normal. A small fraction of these diets resulted in taurine deficiency, but the vast majority of them do not have taurine deficiency. And these dogs are still susceptible to arrhythmia and sudden death. Some of the earlier changes that indicate that the heart is doing a little bit better is a reduction in the size of the left ventricle in diastole and systole, and normalization of left atrial size. We do see cats with dilated cardiomyopathy as well, and those findings are relatively typical for other forms of cardiomyopathy. Enlargement of all four cardiac chambers with reduced contractile function, and the development of congestive heart failure, which may be seen as pulmonary edema, pleural effusion, or less often ascites. Again, on histopathology, often there are minimal changes that are specific for dilated cardiomyopathy. Maybe a little bit of fibrosis and edema and loss of myocytes. On echo, there's systolic as well as diastolic dysfunction, and this leads to the typical neuroendocrine compensatory responses that lead to congestive heart failure. There may be secondary mitral and tricuspid valve regurgitation. It used to be that many cats with dilated cardiomyopathy had taurine deficiency, and then it was recognized that there was not enough taurine in the diets for some cats to maintain normal plasma and whole blood taurine levels. And most diets have been corrected, but cats who are eating a homemade diet or other unusual diets might still get taurine deficiency. And the nice thing about taurine deficiency in cats is that taurine deficiency can be a completely reversible form of dilated cardiomyopathy in cats. At this stage, probably no more than 10% of the cats that we see in our clinic have taurine deficiency when they have dilated cardiomyopathy. Can happen at any age. There's no clear sex predisposition. There are a few breeds that were suspected to be at increased risk. And cats, because they don't need to chase a ball or a frisbee, especially if they live inside. They have a very compressed development of clinical signs. The disease has been getting worse for a long period of time, but the clinical signs they manifest, such as anorexia or lethargy or hiding under the bed, are often present for only 1 to 3 days before they present with severe onset dyspnea or arterial embolism. They may have a soft cardiac murmur on auscultation as a result of mitral or tricuspid regurgitation. Murmurs in cats are usually heard best right at the parasternal location on one side of the sternum or the other. An S3 gallop may be present, and arrhythmias are not unusual in cats with dilated cardiomyopathy. On physical exam, many of the cats are hypothermic, especially if they have congestive heart failure. Arterial pulses are weak. The cats who are hypothermic might have a slow heart rate, and this can be a little bit tricky. You've probably learned that heart failure is associated with a faster heart rate, but in cats, if they're hypothermic, it tends to slow their sinus node firing rate. If they have pleural effusion, you may identify that lung sounds are dull ventrally. If they have pulmonary edema, they may have pulmonary crackles. The jugular vein may be distended, especially in cats that have pleural effusion, and mucous membranes may be pale with slow capillary refill time. Thoracic radiographs often show generalized cardiac enlargement. They may have pleural effusion or pleural fissure lines. Evidence of pulmonary edema may be present as well, with an interstitial or alveolar pattern in the lungs. In cats with heart failure, the veins may be enlarged, but sometimes the arteries are also enlarged, and the vena cava or liver may be enlarged as well. Here's a radiograph of a cat with dilated cardiomyopathy who has pleural effusion. It's hard to see the edge of the heart here. It's a little retraction of the lung lobe up at the top. It's a little pleural fissure line right here, in addition to cardiac enlargement. Electrocardiographic findings are variable with feline dilated cardiomyopathy and can include sinus rhythm or sinus bradycardia. You may see evidence of left atrial or left ventricular enlargement, and ventricular or atrial arrhythmias may be seen. Echocardiographic findings are classic for dilated cardiomyopathy with dilation of all 4 chambers, but especially the left ventricle, reduced fractional shortening and reduced ejection fraction. The papillary muscles are atrophied. The left atrium is often enlarged if there's congestive heart failure, and we may see secondary mitral and tricuspid regurgitation. Here's an example of a cat who has dilated cardiomyopathy. The left ventricle is dilated. The papillary muscles are a little atrophied. There's reduced contractile function to the left ventricle, and the right heart is also significantly dilated. Here's an echocardiogram of the aorta and left atrium from the cat in the previous echo as well. Usually the aorta does not change very much in size, but as heart failure develops, the left atrium gets enlarged. If you identify the size of the aorta just visually, usually in a normal heart can only fit about 2.5 or 3 aortas inside the left atrium. And in this cat, you could put quite a few aortas in the left atrium. There's also evidence of right atrial enlargement and right ventricular enlargement. Here's a long axis view from that same cat. There's dilation of both atria. The left ventricle is dilated with reduced contractile function, and the blue jet is secondary mitral regurgitation. On a complete blood count, that may be normal, or you may see mild leukocytosis. The chemistry profile may be perfectly normal, or there may be evidence of hepatic congestion with elevation of AST and ALT. Cats who are hypothermic may also have prerenal azotemia, or azotemia may develop after initiation of therapy with diuretics. It's a good idea to measure plasma and whole blood taurine concentration in cats with dilated cardiomyopathy. They may be low in a proportion of cats, and in those cats it may be that taurine supplementation can reverse their disease. NT-proBNP is typically elevated in cats, and cats with congestive heart failure due to dilated cardiomyopathy are often hypotensive. Management of cats that have dilated cardiomyopathy can include furosemide, an ACE inhibitor, pimobendan, or a variety of other therapies. Often we would start taurine supplementation until taurine blood levels came back and tell us whether that was an appropriate intervention or not. Horses can also get dilated cardiomyopathy. It's a relatively uncommon disorder. They can get something that looks like dilated cardiomyopathy as a result of exposure to monensin or other toxins. Horses may have a soft cardiac murmur or a loud cardiac gallop, and atrial fibrillation or other arrhythmias may be seen as well. Horses that have congestive heart failure may get pulmonary edema, but it's a little more likely that they will develop peripheral edema with jugular vein distension, especially if heart failure comes on slowly. The best approach to therapy is perhaps yet to be determined, and most horses with dilated cardiomyopathy probably should not be ridden. Ferrets also get a variety of forms of cardiomyopathy, and dilated cardiomyopathy is one of those forms. They often have congestive heart failure at the time of diagnosis of dilated cardiomyopathy, and they have typical radiographic and echocardiographic signs. Cats can also get arrhythmogenic right ventricular cardiomyopathy, and they may or may not have arrhythmias the same way that boxers and English bulldogs do. They tend to get impressive right heart enlargement with significant tricuspid regurgitation, and right heart failure may be developed by the time of diagnosis.